It's a beautiful morning here, and we'll be talking about high blood pressure today. High blood pressure is also known as hypertension, and in Yoruba, it is called Ifunpa Giga generally. Now, high blood pressure is what happens when the pressure within your blood vessels is constantly high, consistently high for a prolonged period of time. Now, when you're measuring the blood pressure, there are usually two numbers. The upper one, known as the systolic, and the lower one, known as the diastolic. Normal blood pressure should not be higher than a systolic of 120 and diastolic of 80 millimeter of mercury. Hypertension is diagnosed if the blood pressure is greater than or equal to 140/90 millimeter of mercury on two different occasions measured by a health professional. Today, we'll simply look at the risk factors for high blood pressure, the symptoms of high blood pressure, and some complications of high blood pressure. In a subsequent episode, I'll be talking about the treatment of high blood pressure. Now, high blood pressure is a silent killer because most times it does not show any symptoms. The only way to know if you're hypertensive is to check your blood pressure, and this should be done by a health care professional. But generally, there are some symptoms that you can look out for. For example, unexplained dizziness, weakness, headaches, severe headaches, especially in the morning, confusion, anxiety, nausea and vomiting, back pain, difficulty in speaking, blurred vision, chest pain. These are some of the symptoms that an individual can experience. Now, what are the risk factors? What can predispose a person to developing high blood pressure? The first thing is old age. The older you get, the more at risk you are of having high blood pressure. Once you're 40 years and above, you need to be keeping an eye on your blood pressure. Number two is genetics. If your father, your mother, your grandparents were hypertensive, then you're at risk of also developing hypertension. Number three, being overweight or obese. When you're overweight, the heart has to work harder to be able to pump blood throughout your very big body frame. Number four, not being physically active is a risk factor. Five, high salt diet and some other diets, some things we consume in our diets, like fatty foods, like canned foods, they are all risk factors. Drinking too much alcohol, taking tobacco, they are all risk factors. Now, what are some of the complications? Some of the complications are stroke, angina, that is chest pain coming from the heart, kidney problems, heart attack, heart failure, irregular heartbeats, dementia. These are a few of the complications of hypertension. I'll be talking about the treatment in a subsequent episode. Thank you and have a lovely, lovely day.